Welcome back to San Antonio Living. Now is the time to take control of your health, and you can do it with the help of the Optimal Health and Wellness Center. Dr. Clay SUGGS is joining us this morning, along with a couple of his wellness graduates. Mary Beth is here, along with Lydia. Thanks, everybody, for coming this morning.
Thank you.
We're going to hear their stories in just a minute, but I want to talk a little bit about diabetes, because we have a huge problem with diabetes here in San Antonio.
Yes. As you know, I've been on a couple of times, and each time it's been a little bit more that we need to talk about and discuss.
Yeah.
Because the diabetes is the fourth leading cause of death in Bexar County. Bexar County happens to be the capital of diabetes in the state of Texas.
Okay.
And so we have a problem with that, so we need to deal with it.
Wow, look at that. And you can see the numbers there. We do have a big problem with diabetes in Texas. Now, is diabetes caused by a weight problem? Is it hereditary? What's the root of diabetes?
Well, a lot of people think it's hereditary, which really is a little bit of the factor, but most of it's cultural.
Okay.
Most of it's our lifestyle. And if you look at San Antonio, we're developing more and more of a problem with that. And you know, diabetes is a precursor to heart disease and to digestive disease, respiratory disease, even cancer. So you need to get tackle it as soon as you can and get a hold of it, take care of it.
We've got one more picture to show you as well. This kind of explains how it starts, and if you have a particular body type, are you more susceptible to diabetes?
Well, yes, diabetes can be a problem, but a lot of people try to just lose the weight, but they don't understand why they have the weight.
Right.
The weight gain. It could be adrenal problem, could be a thyroid problem, could be hormones, could be a liver issue. So you've got to attack it and find out why it's happening in it. And at Optimal Health and Wellness, we do it by restoring their health naturally, holistically, and taking an approach of looking at their labs and other things that might be good insight on what's going on with them.
Okay, and what about medication? When you are dealing with diabetes, are you on a lot of medication?
Well, you know, typically the patients that walk in are on a lot of meds and everything, and so they want to primarily get off meds, and they want to look at a holistic approach. And they may not know what to do, so that's why we're trying to open our doors to your viewers and let them know that, hey, there is an option out there that may work for them.
Okay, we've got two graduates here this morning. These are ladies who have gone through the program. They have each brought with them a bag of medications that they are no longer on, and that is huge, because anyone who takes a lot of pills every day knows that if you can get rid of those and still feel good, you're on the right track. Mary Beth, hold up that bag for me. Those are all the medications that you were on when you first went to see Dr. Clay. Tell me what was going on with you.
When I first started the program with Dr. Clay, I was on diabetes medication, blood pressure medication. I had just seen my doctor and was about to go on cholesterol medication. And for me, it was a point in my life where I realized I had made a big choice in my lifestyle and my diet, and it was a large portion of what put me in the situation I was in. So it was time to make a better choice and change my lifestyle so that I could start reversing some of the things that I had helped have an impact on.
And we've got a picture too, Mary, of you when you first went to see Dr. Clay. That's you on the left, and look at you now. What do you think when you see that picture?
You know, sometimes I never saw myself like that. You know, and I've always made a big joke with everybody. When we talk about weight, you know, people will tell me, well, I weigh 150, I need to lose weight. And I'm like, 150? I haven't weighed that since birth. Give me a break, you know? So for me, it's a totally different. It's a whole lifestyle change, mental change, emotional change. It's great.
Lydia, what about you? Tell me your situation when you first met Dr. Clay.
Well, when I met Dr. Clay, I was gaining weight. My blood pressure was going up. I was pre-diabetic. I was taking medications.
Yeah, let me see your bag there. It's a little bag, but it's because you shoved everything in there. You're trying to make it look smaller.
Exactly. And I was on the verge of adding more medications, and I didn't want that. So thank God that I found Dr. Clay, who helped me, put me on the right track to avoid all those additional medications and get rid of these. So
congratulations.
That's wonderful.
I want to show the before picture of you. Look at you there, and look at the after. And I can see that your after has translated into everyone else that you know. You're very passionate about life and the program, and you just want to share your story. I can see.
Yes.
You know, is this typical for folks when they come to see you, that they're feeling down, they're feeling troubled, they don't feel good? You help them get back and live life better.
Well, you know, in San Antonio, it's everywhere, and people don't know what they can do. And so once you show them a way to live without the medication, and I'm not taking them off the medications. We work in conjunction with their medical doctors.
Yeah.
So we do know that if we improve the body's health nutritionally, that they're going to be able to hopefully get off a lot of the medications that got them in the wrong place. So.
We've got a couple of other before and after pictures. These are some of your wellness graduates and wellness ambassadors. These are people who have really just taken control, and you know, a byproduct of losing weight is, of course, getting off your medication and feeling better. If people are interested in learning more about your program, what you have to offer, you've got a couple of different events that are happening. Tell me about this movie night.
Okay, movie night is the Escape Fire, and it's a very scary movie at this time of year, but it actually is about the healthcare system and behind the scenes, what happens, because we want to expose to the people, to the public, what's happening behind the scenes in the healthcare. And that's tonight. We're going to do that showing tonight at 6:30, and that's free to all your viewers.
Okay.
And then we have another promo with the dinner talks, and we're going to do a diabetic and weight loss dinner talk and a weight loss workshop. And that's going to be also Wednesday and Thursday of this week. Okay,
so here's the deal, guys. Both of these events are free. Let me know if you're coming tonight. You can RSVP. I want to give you the number. It is 681-3333 for the movie tonight. And we also want to have you RSVP for the workshop. And if you are one of the first 50 callers, you are going to receive the free diabetic weight loss workshop, and that is happening Wednesday and Thursday night at Sea Island. But you do need to call right now, okay? So the first 50 callers will be able to go to that workshop for free. The same phone number, 681-3333, the number to call. Thank you so much. Great information. Ladies, thank you for your stories this morning. As if you are ready to get more information, a lot of different opportunities for you to learn more with Optimal Health and Wellness, you can find them at 681-3333, drclay.net, also on Facebook and Twitter.